Today I'm going to explain how to use the elemental diet for SIBO and other gut trouble, so stay tuned. Hey there, if you're new here, my name's Amanda Malacheski. I'm a certified functional nutrition health coach and a digestive and allergy detective. For tips and tricks on how to improve your digestion, please be sure to subscribe and be sure to hit the bell to be notified when I post a new video every week. The elemental diet is a pre-digested meal replacement shake that's often used to treat small intestinal bacterial overgrowth, otherwise known as SIBO. But how do you use it? So by the end of today's video, you'll know 3 different ways to use the elemental diet. You'll know which products I recommend, and you'll also have some ideas about how to reintroduce foods after using the elemental diet. I've helped several clients use the elemental diet and also go through this process of reintroducing foods after using it. So I know that you can get through this process, and I'd like to help you, so let's get started. So what exactly is an elemental diet? It's a hypoallergenic pre-digested meal replacement. And the elemental part of the title means that the nutrition in the diet is already broken down into its most basic elements so that your body doesn't have to do the hard work of digesting it. And because it's in this form, it tends to absorb in the closer end of the small intestine very quickly without having to go through a lot of digestion. And this gives the whole rest of your small intestine and your large intestine a well-deserved break from all of its hard work. And because of this, the elemental diet is very anti-inflammatory. And because there's no fiber, it doesn't feed your gut bacteria either in your small intestine, like in SIBO, or other types of bacterial overgrowths, maybe in your large intestine. Now, there are 3 main ways that you can use an elemental diet. And the one that most people are familiar with is the use of it as a 2 to 3 week period of just elemental diet. You replace all of your food and all of your meals with an elemental diet. And this is actually one of the very best ways to treat SIBO because it really removes the food source for that overgrown bacteria and can lead to a significant drop in the hydrogen and methane gas levels that people have showing up on their SIBO breath tests. But it's also a little bit difficult for people to not eat any food at all for several weeks. So if that sounds like it's way too difficult for you, there are a couple of other ways that you can actually take advantage of the elemental diet still. The second way that you can use it is as a 3 to 4 day gut reset. And this is something that Dr. Ruscio talks a lot about in his book, Healthy Gut, Healthy You. And he recommends using a 3 to 4 day exclusive elemental diet just as a reset when you start any new gut healing program. Or it's also a really great thing that you can use if you are having an active flare of symptoms that you're really trying to get over the hump quickly from. So if you're going to use the elemental diet in this way, you really just use it for 3 to 4 days exclusively, and then you transition back to whole foods and away you go. And this is certainly a lot more manageable than doing a full 3-week course of the elemental diet. So this is a lot more accessible for a lot of people. And then the third way that you can use the elemental diet is to just use it as a single meal replacement at any time. You can use it to replace a breakfast or a lunch or a dinner. I do have clients that regularly do this. I have a client who feels always really bloated towards the end of the day. And so while we've been working together and trying to figure out what's triggering things and what the cause is, they have been regularly using the elemental diet just to replace their dinner because that's the meal that's the most triggering for them and it helps. There are several brands of elemental diet products out there, but there's kind of 2 main ones that I like to recommend. One is the Physicians Elemental. It's by Integrative Therapeutics. It tastes all right, and most people seem to tolerate it, but the only trouble with it is that you need a healthcare provider's recommendation to access it. And the other product are Dr. Ruscio's Elemental Heal products. He has a line of 3 separate Elemental Heal products. There's a regular, there's a low carb version and a whey-free version. And these are really nice if you're already eating a low carb diet and you don't want to go to a higher carb meal, or if you're dairy sensitive and you really want to have an option that doesn't expose you to any dairy contamination at all. That's another great option. So I'll leave a link to his store below this video. I don't get any kickbacks or anything from sale of his products over there, but they really are great and they taste good. And that's the most important thing. A lot of the commercial products before his product and before Physicians Elemental tasted awful, but Dr. Ruscio's products taste delicious. People regularly tell me they taste great. So I'll leave a link for that below this video. All right, now if you've done the elemental diet and you've completed either the 3 to 4 day reset or the 2 to 3 week protocol, and you're ready to reintroduce foods, how do you do that? I have walked a couple of clients through this process thus far, and it usually proceeds pretty easily. So The basic strategy, of course, is to, on the day that you're ready to start reintroducing, you replace one of your elemental diet meals with a regular meal. And in that regular meal, though, you're going to start with liquid foods and very easy to digest things. So these would be things like bone broth or chicken broth, white rice, applesauce, vegetable soup that's pureed, mashed potatoes, something just really easy and sort of pureed and simple to digest. The next day, you can replace a second meal with real food. And then on the third day, you would be back to eating all regular foods. And you can slowly start introducing solid foods as you feel ready. And I would wait to introduce the most difficult to digest foods. So things like meat and nuts and seeds and raw veggies last. Now, if you were on an elimination diet before the elemental diet, this is an excellent, excellent time for you to practice some really great food reintroductions because you have this completely clear palate from which to do reintroductions. Any food reaction you have should be really clear because there shouldn't be a whole lot else going on in your gut. So, if you have had questions about foods where you're like, I'm not really sure if this food is causing reactions or not, this is a great time to do it. And I encourage you to use a tool called a Food-Symptom Diary to work on looking for those reactions. And I do have a whole separate video where I talk about how to use a food diary for IBS. So I will leave a link for that below this video. And then if you've had gut trouble for a long time, IBS, IBD, whether that's sort of constipation type or diarrhea type, this might be a good time to adopt a low FODMAP diet if you haven't already. It might be an easy transition since you're starting fresh from nothing to, just work with that template from the beginning. And then after you've been doing that for a little while and you feel like it's stable, then you could start to slowly expand your options and test some of those foods that you've left out to see if they are problem foods for you. So, the blank slate that the elemental diet is a great opportunity for you to really assess your food sensitivities going forward. A lot of doctors and naturopaths want to retest you after your elemental diet to see how you've responded to that treatment, and they may recommend further elemental diet courses or antibiotics or other treatments. So if you're not sure about what's going on there, be sure to check in with your doctor after your elemental diet. And then one more really thing to consider after doing the elemental diet, and also if you've done antibiotic treatment for SIBO, is to work with something called prokinetics after your course of treatment. Prokinetics are things that help your food move through your intestines at a normal pace. And it's thought that motility problems are one of the main underlying causes of SIBO. It's that things don't move through fast enough, and that gives the food time to ferment and build up a bacterial population in your small intestine where it shouldn't be. So you want to ask your doctor, if you're working with a doctor or naturopath, about prokinetic either prescriptions or over-the-counter herbal varieties. Some of the natural options are things like ginger. There's a supplement called Iberogast, which is a liquid that you drink. There's a supplement called Modal Pro, which has ginger in it, but a few other things. So there are some natural options if that's something that interests you. But there's also some prescription agents, which if you've had really chronic long-term SIBO, I think it's a really good idea to connect with a doctor that can prescribe some of these agents for you, because you don't want to undo all the hard work that you've just done with your elemental diet. What do you want to know about the elemental diet? Leave me a question in the comments. So that's the elemental diet. You can use it as a short 3 to 4 day gut reset for yourself. You can use it as a 2 to 3 week exclusive nutrition program to help eradicate SIBO or other bacterial overgrowths, or you can use it as a single meal replacement at any time. And then after your elemental diet, you reintroduce foods slowly by starting one meal at a time with liquid or very easy to digest solid foods and working your way up to a normal diet. If you've been struggling with eating the right diet for your gut troubles, I want to encourage you to reach out to me. There's 2 main ways that I can help you. The first is you can download my gut recovery guide called Roadmap to Gut Recovery. It's a guide where I show you the step-by-step process that I help my clients walk through to improve their digestion and feel better. You can download your free copy of that by visiting confluencenutrition.com/roadmap. Or if you've already tried a lot of solutions and you just really don't know how to move forward, or you're confused about what to do next, I do work one-on-one with clients, and you can schedule a free 30-minute assessment session with me for me to look at your case and decide if I might be able to help you, and for you to learn more about working with me. You can schedule that by going to confluencenutrition.com/contact, and I'll look forward to seeing you on my schedule. I hope this video helped you feel like the elemental diet is an accessible option for you in your journey to improve your digestive health. It's really not all that scary and shouldn't be overwhelming. If you like this video, please consider liking it or subscribe to my channel, and be sure to share it with people who might otherwise need it. And I will look forward to seeing you next time. Take care.